Biomarkers and Metabolic Disorders, Insights into Dysfunction. Title: Biomarkers and Metabolic Disorders, Insights into Dysfunction. Introduction. Metabolic disorders represent a major global health challenge, with their prevalence steadily increasing in recent years. These disorders, such as diabetes, obesity, and metabolic syndrome, are characterized by impaired metabolism, leading to a range of complications that affect various bodily systems. Early detection, accurate diagnosis, and effective monitoring of metabolic disorders are crucial for successful management. Biomarkers have emerged as valuable tools in providing insights into the underlying dysfunction, aiding in disease identification, monitoring, and treatment strategies. In the context of metabolic disorders, biomarkers can provide valuable information regarding metabolic pathways, hormonal imbalances, and associated complications. As metabolic disorders involve multi-system dysregulation, identifying specific biomarkers can aid in early diagnosis, risk assessment, prognostication, and monitoring treatment response. Biomarkers play a pivotal role in various aspects of diabetes management. Furthermore, novel biomarkers like C-peptide, commercially available in clinical laboratories, can assess insulin secretion and help differentiate between type 1 and type 2 diabetes. Ongoing research also focuses on identifying genetic biomarkers associated with diabetes susceptibility, aiding in risk stratification and personalized treatment approaches. Biomarkers in obesity. Obesity, a complex metabolic disorder, has reached epidemic proportions globally. It increases the risk of numerous comorbidities, including type 2 diabetes, cardiovascular diseases, and certain cancers. Biomarkers play a vital role in assessing obesity-related risks and monitoring treatment efficacy. Adipokines, such as leptin and adiponectin, are hormones secreted by adipose tissue that influence appetite regulation, insulin sensitivity, and inflammation. Measurement of these biomarkers can provide insight into the underlying mechanisms of obesity-associated complications. Integrating these biomarkers in clinical practice holds promise for personalized obesity management. Biomarkers and metabolic syndrome. Metabolic syndrome is a cluster of metabolic abnormalities, often including insulin resistance, obesity, dyslipidemia, and hypertension. These factors synergistically increase the risk of cardiovascular diseases and type 2 diabetes. Biomarkers aid in the early identification and assessment of metabolic syndrome components, facilitating effective intervention strategies. The measurement of waist circumference, fasting glucose, lipid profile, and blood pressure serves as crucial biomarkers in diagnosing and monitoring metabolic syndrome. Future perspectives. The field of biomarkers and metabolic disorders is rapidly evolving, offering promising avenues for personalized diagnostics and therapeutics. Moreover, advancements in technology, such as metabolomics and proteomics, are uncovering new biomarkers and metabolic signatures associated with metabolic dysfunction. These explorations hold immense potential in understanding disease mechanisms and developing novel therapeutic targets. Role of biomarkers in cancer. Cancer represents another major health challenge worldwide, with a complex and heterogeneous nature. Biomarkers have played a crucial role in cancer research, aiding in early detection, prognosis assessment, and personalized treatment selection. In the context of metabolic disorders, certain biomarkers are associated with increased cancer risk. For instance, obesity, a metabolic disorder mentioned earlier, is a recognized risk factor for various types of cancer, including breast, colorectal, and endometrial cancer. Adipokines, such as leptin and adiponectin, which are also biomarkers in obesity, have been found to influence tumor growth and metastasis. Additionally, metabolic biomarkers like lactate dehydrogenase, LDH, and glucose metabolism-related enzymes have been studied in cancer diagnosis and monitoring treatment response. The integration of metabolic disorder biomarkers with cancer biomarkers can provide a comprehensive understanding of the disease and facilitate targeted interventions. Biomarkers play a significant role in the diagnosis, stratification, and monitoring of NAFLD. Liver function tests, including alanine aminotransferase, ALT, and aspartate aminotransferase, AST, are commonly used biomarkers to assess liver damage. These biomarkers aid in risk stratification, identifying patients who are at a higher risk of disease progression, and guiding treatment decisions. Biomarkers in polycystic ovary syndrome, PCOS. Polycystic ovary syndrome, PCOS, is a common endocrine disorder that affects reproductive age women. It is characterized by hormonal imbalances, insulin resistance, and ovarian dysfunction. Biomarkers have emerged as valuable tools in PCOS diagnosis and management. These biomarkers assist in identifying individuals at higher risk for complications, informing treatment strategies, and monitoring response to interventions. Biomarkers and metabolic bone disorders. Metabolic bone disorders, including osteoporosis and Paget's disease, are characterized by impaired bone remodeling and increased fracture risk. Biomarkers are useful in assessing bone turnover, estimating fracture risk, and monitoring treatment response. Biomarkers such as serum calcium, phosphate, alkaline phosphatase, ALP, and parathyroid hormone, PTH, play a key role in diagnosing and evaluating metabolic bone disorders. These biomarkers aid in identifying individuals at higher risk for fractures and assist in monitoring the efficacy of pharmacological interventions aimed at improving bone health. Biomarkers in cardiovascular diseases. Cardiovascular diseases, CVDs, are a leading cause of morbidity and mortality worldwide. Biomarkers play a crucial role in the early detection, risk stratification, and management of CVDs. In the context of metabolic disorders, certain biomarkers are particularly relevant to cardiovascular health. These biomarkers provide important information about lipid metabolism and cardiovascular risk. Integrating metabolic disorder-specific biomarkers with cardiovascular biomarkers offers a comprehensive approach to assessing cardiovascular health in individuals with metabolic disorders. Biomarkers in thyroid disorders. Thyroid disorders, such as hypothyroidism and hyperthyroidism, are common endocrine conditions that can have metabolic implications. Biomarkers are essential in the diagnosis, monitoring, and management of thyroid disorders. Thyroid stimulating hormone, TSH, is a commonly used biomarker to assess thyroid function, with increased levels indicating hypothyroidism and decreased levels indicating hyperthyroidism. Free thyroxine, FT4, and free triiodothyronine, FT3, are additional biomarkers that provide further insight into thyroid hormone levels and metabolic activity.